This presentation will identify toothpaste abrasion as the main reason for the occurrence of non-carious cervical lesions. Non-carious cervical tooth lesions, or NCCLs, are identified by the wearing away or abrasion of hard tooth structure at the gum line. This picture clearly shows a void on the right-hand side of the tooth, which is the result of mechanical processes. The CEJ acronym in this picture, or cemento-enamel junction, identifies this boundary area between the enamel, which covers the crown of the tooth, and the cementum, which covers the root. Caries is a word for tooth decay, since this is a non-carious affliction. It means the wearing of the tooth is accomplished without bacteria and the demineralization that the bacterial plaque colonies create. Here is a picture with two teeth with severe non-carious cervical lesions. The tooth on the left has its non-carious cavity fully exposed. The adjacent tooth on its right has a similar void that has been filled in with a composite material as part of tooth restoration. Today, there are two predominant hypotheses that attempt to explain the essential factors that result in NCCLs. These competing, although not mutually exclusive, etiologies are classified as abfraction theory and toothpaste abrasion. Abfraction is a term that was created by Dr. John Grippo in 1991 to describe an unproven type of tooth wear that he and many researchers believe is caused by grinding of the teeth, also known as bruxing. These lateral forces created by bruxing produce repetitive stresses in the tooth enamel at the gum line, which in time is proposed to crack the enamel and allow it to fall away from the tooth. A simple analogy depicting this fatigue and enamel failure is represented by the nail in the lower right-hand corner of this picture. If the nail is held firmly in a vise and the top of the nail is bent back and forth, the accumulated stresses at the base of the nail will eventually allow the metal to weaken and cause it to break in half. The second, simple, and most likely cause of non-carious lesions at the cervix of the tooth is from toothpaste abrasion. In this theory, it's asserted that the abrasive materials found in toothpaste, along with aggressive lateral brushing habits, can wear away enamel and dentin at the gum line. John Hunter, the surgeon extraordinary to King George III of England, was the first person to document this type of wear in 1771. A quote from Hunter's book suggests a third, though impossible, reason for NCCLs. In it he says, "On their interior surfaces they were hollowed from side to side, as if a round file had been applied to them longitudinally, and had the finest polish imaginable." There are four significant observations that support toothpaste abrasion and minimize the influence of abfraction forces in the formation of non-carious lesions at the gum line. In summary, they are: first, the fact that there's almost no physical evidence of NCCLs before the common use of tooth powders in the early 1600s. Next, tooth powder and toothpaste lesions have been created experimentally in teeth outside the body, while stress-related tooth loss simulating abfraction has never been reproduced experimentally. Another observation is that most NCCLs occur on the buccal or cheek side of the teeth. They're also most commonly seen where individuals tend to brush their teeth the hardest and the longest. And finally, research in 2011 has revealed that most NCCL wear takes place on the softer dentin material normally exposed below the gum line, and not in the tooth enamel that covers the crown of the tooth. These four items will be reviewed further, starting with the history of NCCLs. Hisashi Fujita, a well-known dental paleopathologist, has examined over 8,000 prehistoric skulls without finding a single sign of NCCL. The photograph on the left shows a Jomon-era skeletal jaw and teeth, with no indication of cervical lesions, although occlusal wear on the tops of the teeth indicates a diet of highly abrasive foods. The age of this jaw, about 850 BC, and other prehistoric teeth predates any known use of tooth powders or toothpaste. Fujita also inspected many Japanese Edo period skeletons like the one in the picture on the right. These teeth often had signs of NCCL wear. Toothbrushing was a common practice by this time, and these tooth voids may be the result of brushing the roots of teeth exposed by gum disease. These investigations have created a strong correlation between the appearance of dental tooth cleaners and the appearance of NCCL tooth wear. Dr. Miller was the first person to identify toothpaste abrasion as the source of NCCL wear in 1907. His experiments were successfully reproduced by Dr. Thomas Abrahamson nearly 100 years later. In contrast, finite element analysis of tooth wear has been conducted since the 1950s. These computer simulations of abfraction have not had the required models to define the highly complex environment found during tooth loading. This, along with the lack of physical experiments, reduces the relevance of abfraction as a primary reason for NCCLs. Most NCCL wear occurs on the buccal side of the tooth. This both supports toothpaste abrasion and weakens the claim for abfraction. Everyone tends to brush their teeth longer and harder, and sometimes incorrectly, on the buccal surfaces. This correlates with the surfaces that tend to display NCCL wear the most. An argument and observation in support of abfraction theory would find that NCCL wear exists with equal frequency on both the buccal and the lingual or tongue side of the tooth. This is not the case, and therefore this evidence does not support abfraction. Finally, a critical ingredient in abfraction theory is the tooth enamel. The hardest material in the human body is subjected to repeated flexure, which eventually causes the enamel to crack. Because of its inflexibility and structural qualities, it cannot survive repeated bending and will break apart if forced to do so. The dent material under the enamel, and which supports the enamel, is much softer and not susceptible to fracturing if it is flexed repeatedly. A joint study by the University of Tennessee and Pusan National University of South Korea has determined that very little enamel is destroyed in a typical non-carious cervical lesion. This means that the tooth loss is mainly in the form of the softer dentin material, which has little tendency to fracture in the finite element studies used to characterize and support abfraction. The university's study did not reveal enamel loss above the cemento-enamel junction, as would have been supposed by the core expectations derived from abfraction computer simulations. Now that a clear argument has been presented to identify the abrasive effects of toothpaste, what can be done to avoid the potential pain and disfigurement associated with NCCLs? Simply changing the brands of toothpaste does not solve the problem, since all brands of toothpaste scratch enamel and dentin. The unlikely solution is the reduction or elimination of toothpaste in our oral hygiene routine. A recent study published by the Journal of Periodontology is the latest to confirm that brushing with toothpaste is no better than brushing with water for removing dental plaque and reducing cavities. Since all brands of toothpaste cause tooth wear, and this can potentially lead to cervical lesions, then most people should reduce their frequency of toothpaste use. In summary, there are numerous probable reasons for supporting toothpaste abrasion as the basis for non-carious cervical tooth lesions. Secondly, tooth stresses from bruxing provide a far less likely etiology for the creation of NCCLs. And finally, the simple and safe act of reducing toothpaste use will have a significant effect on reducing the possibility of NCCLs.